Every single day, people leave their doctor's office with a diagnosis, a prescription, or a test result, and no real understanding of what any of it means. Not because their doctor doesn't care, but because the average doctor's appointment is 7 minutes long. 7 minutes to explain something that could change the rest of your life. That gap between what you were told and what you actually need to understand is exactly why I became a nurse. And it is exactly why this channel exists. Here is the other 60 minutes of your appointment. My name is Kelly, and I am a registered nurse with over 10 years of experience in various hospital settings. I have been with patients at the scariest moments of their lives. I have watched people leave the hospital confused, frightened, and completely alone with information they didn't understand. That stops here. In the next 60 minutes, I am going to walk you through the 12 most common health conditions that everyday people and seniors face. Not the textbook version, not the version full of medical jargon that makes your eyes glaze over, the real version, the version I would give to my own family sitting at my kitchen table. For every condition, we are going to cover 3 things: what it actually is in simple terms, what it feels like, and what to do as far as the actual steps to take that protect you and the people you love. Whether you are watching this because you just received a diagnosis, because someone in your family is struggling, or simply because you want to understand your own body better, you are in exactly the right place. Stay with me. This video could be the most important 60 minutes you spend on your health all year. Let's begin. Condition 1, high blood pressure. And I want to start here because this is the condition most likely to be affecting someone watching this video right now, without even knowing it. Here is what makes high blood pressure so dangerous. It can have no symptoms. It most likely won't hurt. It's often invisible until it's too late. You can feel completely normal while it is silently damaging your heart, your brain, your kidneys, and your eyes, sometimes for years. When the heart pumps against high pressure, the muscle walls thicken, eventually making it harder for the heart to fill and pump efficiently. High pressure can weaken blood vessels in the brain, causing them to narrow, rupture, or leak, which is a leading cause of stroke. Your kidneys rely on healthy blood vessels to filter waste. High pressure can cause these vessels to constrict and fail over time. The delicate vessels in your eyes can burst or bleed, leading to blurred vision or even complete blindness if left untreated. That is why we call it the silent killer. It's a quiet threat with loud consequences. Your blood pressure is simply the force of blood pushing against the walls of your arteries as your heart pumps. We measure it with 2 numbers. The top number, or systolic, is the pressure in your arteries when your heart beats. The bottom number, the diastolic, is the pressure when your heart rests between beats. Both numbers are critical for your health. A normal reading is typically around 120/80. This is where your cardiovascular system functions best. High blood pressure, or hypertension, officially begins when your readings consistently hit 130/80 or higher. A hypertensive crisis, the kind that needs emergency care immediately, is a reading of 180/120 or above. When pressure stays high over months and years, your arteries take a beating. They lose their elasticity, they stiffen, they narrow, and your heart has to work harder and harder to push blood through them, leading to total cardiovascular strain. Eventually, that extra strain leads to heart attack, stroke, kidney failure, or vision loss. It's a cascade of events we want to prevent. Now, here is what I need you to hear. Most people with high blood pressure have absolutely no idea they have it. The only way to know is to check it. So what do? How do you take control of your numbers and your future health? Your doctor's office is the gold standard. Professional equipment and trained staff provide the most accurate diagnostic readings. Many pharmacies have public machines. While convenient for a quick check, they shouldn't replace a formal diagnosis from your provider. Home monitors are excellent for tracking your numbers daily. They help your doctor see how your pressure changes in your normal environment. Know your numbers the same way you know your age. Consistency is key because a single high reading isn't always hypertension. If your readings are consistently above 130/80, talk to your doctor. Do not wait for a symptom that may never come. If you have already been diagnosed, don't panic. High blood pressure is manageable, and there are clear steps you can take today. Take your medication exactly as prescribed. Don't skip doses, and don't stop without talking to your doctor first. Reduce sodium in your diet. Sodium acts like a sponge, pulling water into your bloodstream and increasing your overall pressure. The DASH diet, rich in potassium, magnesium, and fiber, is clinically proven to help lower your numbers naturally and effectively. Move your body. You don't need to be an athlete. 30 minutes of brisk walking most days can significantly strengthen your heart. Adding light strength training twice a week helps your body process blood sugar and further supports healthy artery function. Manage your stress. Stress isn't just in your head, it's a physical trigger for your heart. Deep breathing and quality sleep are essential. Don't go it alone. Share your goals with friends or family. These are the things that keep this condition from becoming something far more serious. Remember, this is a journey, not a sprint. Small, consistent changes in your daily routine add up to massive benefits for your heart. High blood pressure is manageable, but only if you know you have it. Get checked, know your numbers, and take that first step today. Your health is worth it. Please consult your doctor before making any changes. Condition 2, type 2 diabetes. And I want to be very clear about something before we go any further. This diagnosis is not a personal failure. It is a complex condition influenced by genetics, biology, and years of silent changes inside the body. I want you to hear that before anything else. Here is what is actually happening. When you eat, your body breaks food down into glucose, sugar, which enters your bloodstream. Your pancreas releases a hormone called insulin. Think of insulin as a key. Every cell in your body has a lock. Insulin unlocks the cell so glucose can get inside and be used for energy. This is how your body fuels its every move. In type 2 diabetes, the locks stop working properly. The cells become resistant to insulin. The key no longer fits. Glucose cannot get into the cells, so it stays in the bloodstream instead, causing the blood sugar to rise and stay high. That is insulin resistance, and it is the foundation of type 2 diabetes. This process often begins years before a diagnosis. Chronic high blood sugar isn't just a number. Over time, it damages the large and small blood vessels throughout your entire body. People with diabetes are twice as likely to develop heart disease or experience a stroke because of the strain on the cardiovascular system. It also affects the kidneys and the eyes. In fact, 1 in 3 adults with diabetes develops chronic kidney disease over time. High glucose also damages nerves, particularly in the feet. This is why tingling, numbness, or slow healing wounds are so critical to monitor. For many years, this process happens with no symptoms at all. When symptoms do appear, they are often subtle but persistent. They include unusual thirst that nothing satisfies, followed by needing to urinate frequently, especially during the night. You might also notice blurred vision, wounds that heal slowly, and a deep fatigue that sleep just does not fix. The only way to know for sure is a blood test called an A1C. It measures your average blood sugar over the last 3 months. The results tell you everything. A level below 5.7 is considered normal. This is the healthy range we aim for. Between 5.7 and 6.4 is prediabetes, a critical warning zone. Anything 6.5 or above confirms a diagnosis of diabetes. So what do you do if your numbers are high? If you have been diagnosed, know that this condition is manageable. Management starts with what you eat. It's about carbohydrate quality. We want to focus on complex carbs over simple carbs. Complex carbs like whole grains and legumes release sugar slowly into the bloodstream, preventing those dangerous spikes. Simple carbs like white bread and sugary snacks hit your system all at once, forcing your body to struggle with the excess sugar. Beyond diet, moving your body consistently is one of the most powerful ways to lower your blood sugar levels naturally. A combination of aerobic exercise like walking and resistance training is best. Muscle is the main site where your body burns glucose. Exercise actually makes your cells more sensitive to insulin for hours afterward, essentially unlocking them more easily. And for many, taking medication as prescribed is the third essential pillar. These tools work together to protect your long-term health. Research shows that even modest changes in weight and activity can dramatically improve blood sugar control and reduce risks. There is another part of diabetes that is rarely talked about, the mental burden. We call it diabetes distress. Managing this condition 24/7 can be exhausting. If you feel overwhelmed or burnt out, please know that this is a normal response. Your emotional health is just as important as your physical health. Don't hesitate to reach out for support from your healthcare team. If you have prediabetes, you are in the most important window of your life. Lifestyle changes alone can prevent type 2 diabetes entirely. That window of opportunity will not stay open forever. Early intervention is the key to a different health future. Know your A1C. It is the most important number most people have never heard of. It's your map to better health. Condition 3, high cholesterol. And I want to start with something that surprises most people. Cholesterol is not your enemy. Your body actually needs it. Every single cell in your body uses cholesterol to function. The problem is not the cholesterol itself. It's having too much of the wrong kind. Here's how it works. Cholesterol travels through your bloodstream attached to proteins called lipoproteins. There are two main types. LDL, low-density lipoprotein, is what most people call bad cholesterol. When LDL levels are too high, it builds up along the walls of your arteries, forming a thick, waxy substance called plaque. Over time, that plaque narrows the arteries, restricting blood flow to your heart and your brain. HDL, or high-density lipoprotein, is what people call good cholesterol. HDL actually picks up excess cholesterol from the bloodstream and carries it back to the liver to be removed. Having more HDL is protective, while having less HDL increases your risk. Here is what makes high cholesterol so dangerous. It usually has no symptoms. You cannot feel plaque building up in your arteries. You cannot feel your blood flow narrowing. The first sign for many people is a heart attack or a stroke. Your cholesterol is measured with a simple blood test called a lipid panel. Total cholesterol below 200 is desirable. LDL below 100 is optimal. And HDL above 60 is protective. Your doctor will look at all of these numbers together, not just the total. So what do? Get your cholesterol checked. Every adult should know their numbers. Reducing saturated fats found in red meat, butter, and full-fat dairy, as well as increasing fiber, oats, beans, fruits, and vegetables can actively help lower LDL. Move your body regularly. Keep active to maintain healthy numbers. And if your doctor has prescribed a medication, take it. Many cholesterol medications are among the most studied and most proven medications in all of medicine. They save lives and can be a key tool in managing your long-term heart health. High cholesterol may be silent, but it is absolutely treatable. Know your numbers. Condition 4, heart failure. Heart failure does not mean your heart has stopped or that your heart is about to stop. I cannot tell you how many times I have watched patients hear those two words and assume the worst. Your heart is still beating, it is still working, it is simply not pumping as efficiently as it should be. Think of a ketchup bottle that is almost empty. You squeeze it hard, but very little comes out. Your heart works the same way in heart failure. It squeezes, it tries, but not enough gets out with each pump to meet your body's needs. When the heart cannot pump forward efficiently, blood backs up. Fluid leaks into the lungs, causing shortness of breath. This is especially noticeable when lying flat. You might find yourself needing extra pillows just to breathe comfortably at night. Fluid also settles in the legs and ankles. This is that swelling that makes shoes feel tight and socks leave deep marks. If you press on the skin and the mark stays, we call that pitting edema. It is a classic sign of fluid buildup. The body receives less blood than it needs, causing a deep, exhausting fatigue that even a full night's sleep cannot fix. These three symptoms together, breathlessness, swelling, and unexplained fatigue, are the classic picture of heart failure. If you or someone you love is experiencing all three of these signs, please do not wait. Early detection is everything. Heart failure is usually the result of other conditions that have strained the heart over many years. Uncontrolled high blood pressure forces the heart to work harder, thickening the muscle until it becomes stiff and weak. Coronary artery disease narrows the vessels, depriving the heart muscle of the oxygen and nutrients it needs to pump well. Or it could be from a previous heart attack that left scar tissue, preventing that part of the heart from participating in the pump. So what do? If you have been diagnosed, the goal is management and protecting the heart function you have left. Take your medications consistently. ACE inhibitors and beta blockers are the cornerstone of treatment. Diuretics, or water pills, Help your kidneys remove that excess fluid so you can breathe easier and reduce swelling. Reduce your sodium intake. Salt acts like a sponge, holding onto water and making the heart's job much harder. Weigh yourself every single morning. A gain of 2 to 3 pounds overnight is almost always fluid, not fat. That rapid weight gain tells us the fluid is backing up before you even feel the shortness of breath. Your care team needs to know. Some patients may also need to limit how much fluid they drink in a day. Always follow your doctor's specific guidelines. Activity is still important, but listen to your body. We want to keep the heart conditioned without overstraining it. Your doctor will monitor your ejection fraction via an echo. This is just a percentage showing how much blood the heart pumps out. They will also use EKGs and blood tests like BNP to check for heart strain and ensure your treatment is working. We need to move past the stigma of the word failure. It is a chronic condition, much like diabetes or asthma. Heart failure is serious, but it is one of the most treatable chronic conditions in medicine when managed properly. You are not alone in this. Your care team is there to adjust your cocktail of medications to find what works best for you. Your lifestyle choices, what you eat, tracking your weight, and avoiding smoking make a massive difference in your quality of life. With the right management, many people with heart failure live full, active, and long lives. Your heart is still fighting for you. Every beat is a testament to its resilience. Work with it, not against it. Condition 5, stroke and TIA. I want to be direct with you in this segment because the information I am about to share could save your life or the life of someone you love. A stroke happens when blood supply to part of the brain is suddenly cut off. Brain cells begin to die within minutes. Every minute without treatment means more brain tissue lost, more function potentially gone forever. Speech, movement, memory, vision, all controlled by brain tissue that cannot survive without blood. There are 2 main types. An ischemic stroke, the most common, happens when a blood clot blocks an artery supplying the brain. A hemorrhagic stroke happens when a blood vessel in the brain bursts and bleeds. A TIA, transient ischemic attack, is often called a mini-stroke. Symptoms appear suddenly, then resolve within minutes to hours. Many people dismiss it entirely. That is one of the most dangerous mistakes a person can make. A TIA is your brain sending an emergency warning. 1 in 3 people who have a TIA will have a full stroke within a year if they do not seek treatment immediately. The most important thing I can teach you in this segment is the FAST acronym. This is how you recognize a stroke in yourself or someone else. F is for face. Ask the person to smile. Is one side drooping? A is for arms. Ask them to raise both arms. Does one drift downward? The S is for speech. Ask them to repeat a simple phrase. Is it slurred or strange? T is for time. If you see any of these signs, call 911 immediately. Do not drive yourself. Do not wait to see if it improves. Time is brain. So what do you do? If you witness these signs, call 911 right now. If you have risk factors, high blood pressure, diabetes, high cholesterol, atrial fibrillation, or smoking, work with your doctor to manage them aggressively. These are the conditions that cause strokes. Controlling them is how you prevent it. Know fast, share fast. It saves lives. Condition 6, COPD, chronic obstructive pulmonary disease. And I want to start by saying something that many people with this condition have never heard. What you are feeling is not normal aging. Struggling to breathe, doing things that used to be easy is not simply getting older. It is your lungs telling you something important. COPD is a chronic lung condition where the airways become inflamed. Think of it as your airways becoming narrowed and damaged over time, making it increasingly difficult to breathe air out of the lungs fully. Think of breathing through a normal straw versus breathing through a straw that has been pinched and crumpled. The air gets in, but getting it back out requires enormous effort. That trapped air is what causes problems. That trapped air is what causes the characteristic barrel-chested appearance many people with advanced COPD develop. There are 2 main conditions that fall under COPD. The first is emphysema. This is where the tiny air sacs in the lungs called alveoli are destroyed, reducing the surface area available for oxygen exchange. The second is chronic bronchitis, where the airways are persistently inflamed and produce excess mucus. This causes a chronic cough that lasts for months at a time. It's a heavy, taxing burden on the body. Smoking is the leading cause. responsible for around 85% of all COPD cases. It is the primary risk factor. But long-term exposure to air pollution, chemical fumes, and dust can also cause it. Environment matters. And some people develop COPD without ever having smoked. It's important not to place blame, but to seek help. Symptoms develop slowly over years. It can be easy to miss the early signs because they creep up on you. You might notice a persistent cough that produces mucus, or shortness of breath during activities that used to be easy, wheezing, chest tightness, frequent respiratory infections, and an overall sense of fatigue that doesn't go away. COPD is diagnosed with a simple breathing test called spirometry. It's non-invasive and very effective. You breathe into a tube, and the machine measures how much air you can move and how fast you can exhale. So what do? If you are diagnosed, there are powerful steps you can take right now. If you smoke, stopping is the single most powerful thing you can do to slow progression. It's never too late. No medication works as well as that one decision, but inhalers, bronchodilators, and corticosteroids are also vital. These open the airways and reduce inflammation, making breathing significantly easier day to day. Pulmonary rehabilitation, a supervised exercise and education program, has been shown to meaningfully improve quality of life. COPD cannot be cured, but it can absolutely be managed. This is a very important distinction to understand. Millions of people live well with this condition every single day. You are not alone in this journey. The key is understanding it early enough to protect what lung function you have left. Knowledge is your best tool. Condition 7, chronic kidney disease. And this one I need you to pay very close attention to. Because of all the conditions we are covering today, this may be the most silent of all. Your kidneys are 2 fist-sized organs sitting just below your rib cage on either side of your spine, and their job is extraordinary. Every single day, your kidneys filter around 200 liters of blood, removing waste products, excess fluid, and toxins, and sending them out of the body as urine. They also regulate your blood pressure, balance your electrolytes, and tell your bones to produce red blood cells. They do all of this quietly, constantly, without a single symptom until a significant amount of function is already lost. Chronic kidney disease happens when the kidneys are damaged over time and gradually lose their ability to filter properly. The most common causes are diabetes and high blood pressure, 2 conditions we have already covered today. This is not a coincidence. When blood sugar stays high for years, it damages the delicate filtering vessels inside the kidneys, and when blood pressure also stays high for years, it does the same. This is why managing both conditions is so critically important, not just for your heart, but for your kidneys too. In the early stages, there are almost no symptoms. This is what makes it so dangerous. By the time symptoms appear, such as swelling in the legs and ankles, persistent fatigue, changes in urination, shortness of breath, nausea, and a metallic taste in the mouth, kidney function may already be significantly reduced. Kidney disease is measured in stages from 1 to 5 based on how well the kidneys are filtering. A blood test called eGFR, estimated glomerular filtration rate, tells your doctor exactly where your kidneys stand. A urine test checking for protein is another early warning sign. Healthy kidneys do not let protein leak into urine. Diabetes is the leading cause of kidney failure in the United States. High blood pressure is the second. Together, they account for the majority of people on dialysis today. So what do? If you have diabetes or high blood pressure, ask your doctor specifically about your kidney function at your next appointment. Ask for your eGFR and for a urine protein test. These are simple tests that could catch damage early enough to slow or stop it. If you have already been diagnosed with kidney disease, protect what function you have. Control your blood sugar and blood pressure aggressively. Reduce sodium and protein intake as directed by your care team. Stay hydrated. Avoid medications that damage the kidneys, including high doses of anti-inflammatory drugs like ibuprofen taken regularly, and attend every follow-up appointment without exception. Your kidneys have been quietly protecting you your entire life. Now it is your turn to protect them. Condition 8, thyroid disease. And this one is personal for a lot of people watching, because thyroid problems are among the most commonly missed and misdiagnosed conditions in medicine. If you have been told your exhaustion is just stress, your weight gain is just aging, or your symptoms are just anxiety, please stay with me for this one. Your thyroid is a small butterfly-shaped gland sitting at the base of your neck, and despite its size, it controls an enormous amount of what happens in your body. Your thyroid produces hormones that regulate your metabolism, essentially the speed at which every cell in your body operates. Think of it like the thermostat in your home. Set it too low and everything slows down. Set it too high and everything races. There are two main types of thyroid disease: hypothyroidism, where the thyroid is underactive and does not produce enough hormone. Everything slows down, the metabolism drops. Symptoms include persistent fatigue that sleep does not fix, unexplained weight gain even without eating more, feeling cold all the time when others are comfortable, dry skin and hair loss, constipation, brain fog, depression, and a slow heart rate. This is the most common type and affects far more women than men, particularly after the age of 60. Hyperthyroidism, on the other hand, is where the thyroid is overactive and produces too much hormone. Everything speeds up. Symptoms include unexplained weight loss despite eating normally, a racing or irregular heartbeat, feeling hot and sweaty when others are comfortable, anxiety, trembling hands, difficulty sleeping, and frequent bowel movements. Both conditions are diagnosed with a simple blood test measuring TSH, thyroid stimulating hormone. This is the single most important thyroid number. When TSH is high, your thyroid is underactive. When TSH is low, your thyroid is overactive. So what do you do? If you recognize these symptoms in yourself, ask your doctor specifically for a TSH blood test. Do not accept fatigue, weight changes, or mood symptoms being dismissed without your thyroid being checked. It is a simple test and it changes lives when it catches what has been missed. Hypothyroidism is often treated with a daily thyroid hormone replacement tablet called levothyroxine, which most patients take for life and which restores normal function remarkably. Hyperthyroidism has several treatment options, including medication, radioactive iodine therapy, and in some cases, surgery. Thyroid disease is not in your head. It's in your blood work, and you can get it checked. Condition 9, arthritis. One thing to note is that arthritis is not simply something you have to accept as part of getting older. Yes, it becomes more common with age, but there is a significant difference between understanding what is happening in your joints and simply suffering through it. That difference is what this segment is about. Most people use the word arthritis as if it is one condition, but it's not. There are over 100 types of arthritis, but 2 account for the vast majority of cases, and they are very different from each other. Osteoarthritis, the most common form, is a wear and tear condition. The protective cartilage that cushions the ends of your bones gradually breaks down over time. When that cushioning is gone, bone begins to rub against bone. The result is pain, stiffness, swelling, and reduced range of motion, most commonly in the knees, hips, hands, and spine. Osteoarthritis develops slowly over years and is strongly associated with aging, excess weight, and previous joint injuries. Rheumatoid arthritis is fundamentally different. It is not wear and tear. It is an autoimmune condition, meaning the immune system mistakenly attacks the lining of the joints called the synovium. This causes chronic inflammation, pain, swelling, warmth, and over time, joint damage and deformity. Rheumatoid arthritis often affects joints symmetrically, both hands, both wrists, both knees at the same time. It is also associated with fatigue, fever, and a general feeling of being unwell that osteoarthritis does not cause. Symptoms common to both include joint pain that worsens with movement, or at the end of the day, morning stiffness that takes more than an hour to ease, swelling and tenderness around the joint, and reduced ability to move the joint fully. Arthritis is diagnosed through physical examination, blood tests, and imaging. For rheumatoid arthritis, specific blood markers, including rheumatoid factor and anti-CCP antibodies, help confirm the diagnosis. So what do you do? For osteoarthritis, maintaining a healthy weight takes enormous pressure off weight-bearing joints. Every pound lost reduces the force on your knees by 4 pounds with every step. Low-impact movement, walking, swimming, cycling, keeps joints mobile and reduces stiffness. Physical therapy builds the muscles around the joint, providing better support. Anti-inflammatory medications manage pain, and in advanced cases, joint replacement surgery can restore remarkable function and quality of life. For rheumatoid arthritis, early aggressive treatment is everything. Disease-modifying medications called DMARDs, particularly methotrexate, can slow or stop the immune attack on the joints before permanent damage occurs. Biologic medications have revolutionized treatment for people who do not respond to DMARDs. The earlier treatment begins, the better the outcome. Pain is not something you simply have to live with. Talk to your doctor. There is more that can be done than most people realize. Condition 10, osteoporosis. And like several conditions we have covered today, this one gives you almost no warning until something goes seriously wrong. Osteoporosis means porous bones. As we age, our bones naturally lose density, becoming lighter, thinner, and more fragile over time. In osteoporosis, that process accelerates significantly. Bones that were once dense and solid develop tiny holes and spaces throughout their structure, like a sponge becoming more and more hollow from the inside. The result is bones that fracture far more easily than they should. A minor fall that a younger person would walk away from can cause a devastating hip fracture in someone with advanced osteoporosis. In some cases, bones become so fragile that a simple sneeze or stepping off a curb can cause a vertebral fracture in the spine. Here is what makes osteoporosis particularly dangerous in older adults. A hip fracture is not simply a broken bone. For seniors, a hip fracture is a life-changing event. Around 20% of seniors who suffer a hip fracture die within 1 year from complications. Many more lose their independence permanently. This is not meant to frighten you. It is meant to make clear that preventing this condition is one of the most important things you can do for your long-term health and independence. Who is most at risk? Women are significantly more affected than men, particularly after menopause when estrogen levels drop sharply. Estrogen plays a crucial role in maintaining bone density, and its loss accelerates bone thinning dramatically. Thin body frame, family history, smoking, excessive alcohol consumption, low calcium and vitamin D intake, and long-term use of corticosteroid medications all increase risk significantly. Osteoporosis often has no symptoms. Bone loss happens silently over decades. The first sign for many people is a fracture. This is why screening matters so much. A bone density scan, called a DEXA scan, is the gold standard for diagnosing osteoporosis. It is painless, takes about 15 minutes, and gives your doctor a precise picture of where your bone density stands. Women over 65 and men over 70 should discuss this test with their doctor. Younger postmenopausal women with risk factors should ask about it sooner. So what do? Calcium and vitamin D are the foundation of bone health. Calcium-rich foods, dairy products, leafy green vegetables, fortified foods, combined with adequate vitamin D, either through safe sun exposure or supplementation, support bone maintenance throughout life. Weight-bearing exercise, walking, dancing, light resistance training, signals the body to maintain and build bone density. It is one of the most powerful tools available, and it costs nothing. If you have been diagnosed with osteoporosis, medications called bisphosphonates, such as alendronate, are highly effective at slowing bone loss and reducing fracture risk. Newer medications offer additional options for those who need them. Fall prevention is equally important. Removing trip hazards at home, improving lighting, wearing appropriate footwear, and having your vision and balance checked regularly all reduce the risk of the fall that leads to the fracture. Your bones built themselves over a lifetime. Now they need you to protect them. Condition 11, dementia and Alzheimer's disease. If this topic brought someone specific to mind when I said it, someone you love, someone you are watching change, I want you to know that what you are feeling right now is one of the most common and most human experiences there is. You are not alone in it. Let me start with something that confuses almost everyone. Dementia is not a single disease. It is an umbrella term, a way of describing a group of symptoms that affect memory, thinking, behavior, and the ability to perform everyday tasks. Alzheimer's disease is the most common cause of dementia, accounting for around 60 to 80% of all cases. But there are other causes too, including vascular dementia, caused by reduced blood flow to the brain, Lewy body dementia, and frontotemporal dementia. Understanding the difference matters because different types of dementia can progress differently, affect different abilities first, and sometimes respond to different approaches. Alzheimer's disease is caused by the buildup of abnormal protein deposits in the brain, amyloid plaques, and tau tangles that disrupt communication between brain cells and eventually cause them to die. The brain literally shrinks over time as cells are lost. The areas affected first are those responsible for memory, which is why forgetting recent conversations, appointments, and names is typically the earliest sign. Here is something critically important that families often do not know. There is a difference between normal age-related memory changes and early dementia. Occasionally forgetting where you put your keys and then remembering later, that is normal aging. Forgetting that you own a car, that is not. Struggling to find a word occasionally, normal. Losing the thread of a conversation entirely and repeatedly, worth discussing with a doctor. Early warning signs of Alzheimer's and dementia include memory loss that disrupts daily life, difficulty planning or solving problems, confusion with time or place, trouble understanding visual images, new problems with words in speaking or writing, misplacing things and being unable to retrace steps, decreased or poor judgment, withdrawal from social activities, and changes in mood and personality, particularly increased anxiety, suspicion, or depression. Dementia is diagnosed through cognitive testing, brain imaging, and blood tests that help rule out other causes of memory loss, some of which are treatable. Thyroid problems, vitamin B12 deficiency, and certain medications can all cause memory symptoms that mimic dementia. This is why a thorough evaluation is so important rather than assuming. There is currently no cure for Alzheimer's disease. I want to be honest with you about that. But there are medications that can slow the progression of symptoms in some people and meaningfully improve quality of life. And there are new disease-modifying treatments that have recently been approved that represent genuine progress for the first time in decades. So what do you do? If you are noticing these changes in yourself or someone you love, speak to a doctor sooner rather than later. Early diagnosis matters. It allows for planning, for treatment options, for legal and financial arrangements to be made while the person can still participate in those decisions. It also allows families time to understand what is coming, time to prepare, and time to simply be present with their loved one in the ways that matter most. Protecting brain health throughout life matters too. Managing blood pressure, staying physically active, staying socially connected, sleeping well, and continuing to learn and challenge the mind are all associated with reduced dementia risk. None of them guarantee prevention, but all of them shift the odds in your favor. To every caregiver watching this, what you are doing is one of the hardest and most important things a human being can do for another. Please take care of yourself too. Condition 12, atrial fibrillation. Most people know it simply as AFib, and this one matters enormously because it affects over 6 million Americans. It is the most common heart rhythm disorder in the world, and most people who have it either do not fully understand it or do not know they have it at all. Your heart has 4 chambers. The 2 upper chambers are called the atria. In a normal, healthy heart, electrical signals fire in an organized, coordinated sequence. This causes the heart to squeeze and pump blood in a smooth, steady rhythm. That rhythm is what we feel as a heartbeat. In AFib, those electrical signals become chaotic. Instead of firing in an organized sequence, they fire rapidly and irregularly. This causes the upper chambers of the heart to quiver rather than squeeze properly. That inefficient quivering has 2 major consequences. First, the heart cannot pump blood as effectively. Blood pools in the upper chambers instead of being pushed out cleanly. This causes symptoms, including a racing or fluttering heartbeat that comes and goes, palpitations that feel like your heart is skipping or flopping in your chest, shortness of breath, especially with activity, dizziness or lightheadedness, extreme fatigue, and in some cases, chest discomfort. Some people feel every episode dramatically. Others feel nothing at all and only find out during a routine EKG. Both experiences are real and both are equally serious. Second, and this is the most important thing I'll say in this segment, when blood pools in the upper chambers of the heart, it can form clots. Those clots can travel from the heart to the brain, and that is a stroke. People with AFib have 5 times the risk of stroke compared to people without it. 5 times. This is why AFib is not simply an inconvenience or a nuisance rhythm. It is a condition that demands proper management and, in most cases, blood thinning medication to prevent exactly that outcome. AFib is diagnosed with an EKG, a simple, painless test that records the electrical activity of your heart. Many smartwatches can now detect irregular heart rhythms. Those smartwatches can then prompt people to seek evaluation. If your watch has flagged an irregular rhythm, please take that seriously. Risk factors include age. AFib becomes significantly more common after 65. High blood pressure is the single most modifiable risk factor for AFib. Heart disease, diabetes, obesity, sleep apnea, thyroid disease, and excessive alcohol consumption all increase risk meaningfully. So what do you do? If you experience a racing irregular heartbeat, palpitations, unexplained shortness of breath, or dizziness, speak to your doctor and ask for an EKG. Do not dismiss these symptoms as anxiety or aging. If you have been diagnosed with AFib, the 2 goals of treatment are controlling the heart rate and preventing stroke. Rate control medications help the heart beat more steadily. Blood thinners, anticoagulants, reduce the risk of clot formation and stroke dramatically. For some people, procedures including cardioversion or ablation can restore normal rhythm entirely. Taking your blood thinners consistently is not optional. I have seen what happens when people stop them because they feel fine. Please do not make that mistake. AFib is manageable. Stroke is preventable. Know your rhythm. We just covered 12 of the most common health conditions that everyday people and seniors face. High blood pressure, type 2 diabetes, high cholesterol, heart failure, stroke and TIA, COPD, kidney disease, thyroid disease, arthritis, osteoporosis, dementia and Alzheimer's disease, and atrial fibrillation. That is a lot to take in, and I want to acknowledge something. If you watched this entire video, you did something most people never do. You chose to understand your health rather than fear it. That matters more than you know. Here's what I want you to walk away with today. Your body is always communicating with you. Symptoms are not inconveniences. They are messages. And understanding what those messages mean is the difference between catching something early and finding out too late. You don't need a medical degree to understand your own health. You need someone willing to explain it clearly and honestly. That's what this channel is here to do. Every single week, your health deserves to be understood. If something in this video made you think of someone, a parent, a spouse, a friend, a neighbor, please share it with them, because that person deserves to understand their body the same way you do now. Health information should not be a privilege. It should be available to everyone from someone who genuinely cares. Every week on this channel, I cover a new health condition or medication. The kind of information that used to only exist in medical textbooks, delivered here for free, for you, for as long as you need it. If today helped you, please subscribe so that next week's video finds you the same way this one did, right when you need it. And if you want to go deeper on any of the conditions we covered today, I have many full individual videos on most of these conditions already on this channel. Thank you for spending this hour with me. Take care of yourself, and I will see you next week.